Next, we are going to have our patient experience panel. We had 4 talkers originally. Unfortunately, Janelle could not make it. She is home with COVID. So I have the honor of introducing our incredible patient experience panel here today. We have a little change in our speakers, as I mentioned. Janelle could not make it, but we have the incredible Janice Sherwood in her place. So yes, round of applause for all of our speakers. Thank you guys so much for agreeing to do this. First off, we have Jana Hale, who's going to be speaking about her experience as a symptomatic woman.
Hello, my name is Jana. I'm a symptomatic woman with ALD. Progressive and incurable. Those are the words that I'll never forget that followed my diagnosis of ALD, that had taken me 3 long years to find. Part of me was happy to finally put a name to the horrible symptoms that I had been experiencing. The other part of me was scared to realize what that progressive adjective would bring. But I knew that I would do everything in my power to slow the progression. I was told that I need to come to grips with the reality that I'd be in a wheelchair within 3 to 5 years because of the debilitating muscle weakness that was to come. But she also told me that I was a unicorn, a unique, beautiful, one-of-a-kind masterpiece, and I should never forget that. In my late 30s, I found myself tripping quite often, even falling to the ground. Every time I would look back to see what I had tripped on, only to see nothing had gotten in my way. In addition, friends started asking me what was wrong, why I was limping. I thought they were crazy. I didn't know I was limping at all. The falling became more frequent, and I had a difficult time maintaining my balance. I noticed I wasn't able to keep my hands in my pockets while walking, and I couldn't get up a set of stairs without holding on. My internist agreed something was definitely off, so then began my quest to figure out what it was. It took 3 years, a myriad of specialists, including 2 different neurology groups, until I was finally diagnosed. The first challenge I faced after being diagnosed was living in California. I had seen 3 different neurologists, none of whom had much knowledge of ALD. It's really scary to be in a position where, no fault of their own, but you can't trust your doctors. There were several times I had been told things by doctors that are completely contradictory to what is known of the disease. Thankfully, after much research, I was able to find Dr. Eichler on the other side of the country. He and his staff have also been gracious enough to introduce me to other specialists who I see when I coordinate my visits at Mass General. I travel annually to see them, and I hope they realize the amazing gift they are to me and the peace of mind that I have because of them. Knowing that I can reach out to them at any time is invaluable to me. Being asked to verbalize how ALD impacts my daily life is a difficult and emotional one, as I make it part of my daily life not to focus on what I can't do, but to count all of my blessings. I consider myself to be a very positive, upbeat person, but no one knows the struggles I face internally each day, starting with getting out of bed. I used to find myself quick to jump out of bed, ready to start the day, but now I'm slow to get up, not knowing if my muscles are ready to cooperate. Because of the stiffness, I start every morning with a session of stretching exercises that helps greatly. In addition, I exercise 5 to 6 times a week. I've found that I get the best results when I work with a personal trainer 3 times a week. My best advice to anyone diagnosed with ALD is to keep moving. The biggest challenge I faced when going to a trainer was simply getting started. Along with so many other burdens, ALD has severely limited my physical abilities, so I was embarrassed at the thought of even walking into a gym. Every day, I remind myself that what is most important is to do my personal best and never compare my abilities to anyone else's. Last year, I was given the honor of receiving the most inspirational award at my gym. I feel so fortunate to be a part of a family where I can come as I am, be cheered on and celebrated for my progress, no matter how big or small it might be. I also see a physical therapist weekly who is amazing at recommending exercises for me that work with my abilities and help me maintain the strength that I have. I feel so blessed to have found a village of providers who are helping me to navigate all of the unknowns associated with ALD. I do some sort of cardio 20 minutes almost every day, balance exercises, and walk in the shallow end of my community pool on days I don't do training. Sometimes it feels like a full-time job just fighting this terrible disease. My daily outings have been severely limited by ALD. I no longer go anywhere by myself that's unfamiliar or where I can't push a cart. I won't even go to friends' homes alone anymore because I can't walk on grass, driveways, or steps without handrails. Thankfully, I'm married to an amazing man and have the most understanding and encouraging daughter who are fighting right alongside of me. They help me unconditionally to live my best life. One thing ALD has forced me to do is to give myself grace and realize that some days will be better than others. I've learned to delight in those good days and never take them for granted. It's my hope that a therapy will be developed that would improve my quality of life and enable me to not be a burden to my loved ones. My 6-year-old nephew, Callan, doesn't know the disorder I've been diagnosed with, and it's never a discussion. Every time he leaves me, he says, "Bye, Auntie Jana. I hope your legs feel better soon." It's my hope that as a result of new treatments or therapy, I can finally tell Callan that my legs are feeling better.
Wow, Jana, very touching. Thank you for your strength. Thank you so much for sharing your personal story with us. We really do appreciate that. Next, we have Morgan Bullard, who's a newborn screening mom.
Houston area, now it's on. My name is Morgan Bullard. I'm from the Houston area, so I'm super grateful that I was able to attend this today, and I thank you for all being here. My daughter was born on November the 27th, 2022, so we're coming up on a year her birthday. So putting this all together was a little bit raw for me still. She was born, like I said, on November 27th. We got a phone call on December the 2nd. I will never forget that day. We had our newborn pictures that morning. We got up, we got dressed. It was a normal day. It was very exciting. My son was 3.5 at the time, so it was a really fun day for us. And it was about 6 o'clock when we got a phone call from our pediatrician, which wasn't normal, so I was immediately alarmed. And that's when he told us that our daughter had been flagged for ALD on her newborn screening. And I will never forget those feelings and those emotions in that moment. I remember walking around our backyard and pacing and Googling while I'm on the phone with our doctor, and he had already reached out to another provider, another colleague of his, because he had never seen this in practice before. So he had reached out to try to provide me with the best information that he could at the time. And unfortunately, we had more questions for him that he could answer. So he talked to us for about an hour on the phone. I'm forever grateful for that. And he talked us through the next steps, which we're going through with a second newborn screening just to make sure that it wasn't a false positive. So we went through with that. And at the same time, they did another very long chain fatty acid on her as well, just to make sure. And that test came back positive as well. So from there, we were, of course, sent for genetic testing for her. And at the time, we decided to test all 4 of us at the same time because, as you all know, these tests are not done quickly. And so we just wanted to get it done as soon as possible versus waiting the 21 days and then 21 days again. So we went here to Texas Children's and we all got our genetic testing, and I was actually diagnosed through that process as well. My son, thankfully, is negative. He's 4.5 now. That was the biggest blessing of all of this. But I feel like my newborn screening experience is a lot like many others in the room, where your child, your first child was missed on newborn screening because it wasn't being done at the time. My son personally, he was 2 months old before they started testing in Texas. So he had just missed the mark. And so we went through a lot of trauma with that whole process because it wasn't being tested yet at the time. And so thankfully, I discovered the Facebook groups and the ALD community, and you all have been wonderful and a great support system for us newborn screening moms. And I think speaking on behalf of all the newborn screening moms, we can never thank you enough for that. So one thing I did want to mention, I put the time that it took for all of this, and I think mine is pretty short in comparison to a lot of other women as well. In the U.S., the maternity leave is pretty short, and so when you think of all of this trauma that you're experiencing and that you're going through, it pretty much takes up all of your maternity leave, and it's a very difficult time during that process, and to have all of you in this room and everyone that's not here being able to support us, it means a lot to us.
Thank you so much, Morgan. Next, we have Janice Sherwood be speaking about her experience as an ALD mom.
Hello, I am from Vista, California, which is in North San Diego County. I am very happy to be here and see so many of my familiar faces and those that I've never met before, although I've seen you on Facebook a lot. I have a pretty tragic story, and I'm going to try to get through it without crying. Not off to a good start, am I? In 2003, my 8-year-old son, Sawyer, had an adrenal crisis and was unfortunately diagnosed with ALD. Prior to that, he had been diagnosed with attention deficit disorder, recurrent viral infections, and childhood onset migraines. At that point, I had asked for a CAT scan or an MRI so that we could rule out anything that might be causing all of these symptoms to come on in a relatively short period of time. And I was denied and said that there was nothing neurologically wrong that would point to the expense of having that test done. And unfortunately, 3 weeks later was when he had his adrenal crisis and ended up in the Children's Hospital in San Diego. It was a very tragic period of time. He had severe swelling in his brain, and so they had to put a shunt in to drain the fluid out and to monitor the pressure. And not knowing exactly what ALD was at the time, the doctors didn't realize that that was going to cause the disease to progress very rapidly. Because he already had cerebral involvement at the time, was just compensating very well for it. Unfortunately, he only survived 6 months after that diagnosis. But we immediately got the family tested, and I tested positive. My daughter, who just turned 30, tested positive. My mother, who just passed away last month from complications of ALD, tested positive. And then we did not have any, well, my brother tested negative and my sister's son tested negative. So that's where we stopped screening at that point. But once I started learning about the adult onset, we started looking at my mom's only brother, my uncle, Lonnie, who had passed away at the age of 55. And we looked at his autopsy and his records and saw that he had been diagnosed or misdiagnosed with debilitating arthritis and unknown brain disease. So 99.9% sure that that's that he had the cerebral ALD as well. We also looked at my grandmother, who had been diagnosed with degenerative disc disease and was in major pain for most of her life that I knew her. so we're pretty sure she had it. And then some of her sisters had boys that died from the complications of the flu when they were 3 and 4 years old. So we're pretty sure that that was the adrenal insufficiency that was causing their deaths. So it's pretty devastating when you start realizing that this disease is in your family for that many years, and then your son's diagnosed and there's absolutely nothing that you can do. That spurred me into action, and I started the Fight ALD Foundation, fighting illness through education, and decided that I was going to try to educate as many physicians as I could so that they would know that there was a simple blood test that cost less than $200 that could be done if you were looking at a boy that maybe was being screened for attention deficit disorder or recurring viral infections, any of the same symptoms that my son had. Because knowing that you could screen and then you could monitor and you could treat these boys and have a chance for their lives meant a lot to me. And so I made that my life mission. I actually took an RV on the road and was going to visit 215 children's hospitals in 48 states. And in my first week, realized I was driving past pediatric clinics and family practices, and I decided we would prefer to have them diagnosed before they end up in the ER. And I ended up going to over 3,200 medical facilities, put 44,000 miles on a 1981 RV. It's been as much time in a garage as I did driving it, I think, getting repairs done. When I finished that expedition in 2013, I was contacted by Patty Chapman, the president of the Mylan Project, and Gina Cousineau, and they asked me if I would be interested in helping get newborn screening in the state of California, which I gladly accepted the challenge. And we were very fortunate to get it approved, but unfortunately they were not going to screen until we had it added to the recommended uniform screening panel. So there's quite a few people in this room that helped with that effort as well. And so they did start screening in 2015. Unfortunately, it didn't roll out the way that we had planned, so a lot of the families that got the diagnosis were not given any appropriate information on what to do. It's taken quite a few years to get to that point, and with the help of Elisa Seeger and a whole group of people, we put together the Standards of Care, which is now available to all families. And now I'm symptomatic. I guess I should throw that out there too. So it's the gift that keeps on giving. And as my friend Jesse says, it's a shitty disease, but great people. So thank you for your time.
Thank you, Janice. Next, we have Aaron Gardner. He's going to be speaking about his experience as an AMN man.
Good morning. My name is Aaron Gardner. I'm from Washington State, in between the Seattle and Tacoma areas, if anybody is familiar with that. I'm 37 years old, and I was diagnosed with adrenomyeloneuropathy about 8.5 years ago. I just wanted to ask if we can do a show of hands. How many men with AMN are in the room right here, if you don't mind raising your hand? I just want to see how many gentlemen we're speaking to here. Thank you. I mean, this conference has already been so great. I mean, last night, when we were just sitting in the hotel restaurant or hotel bar, some of us, felt like a high school reunion almost. It was like running into people that I've met in the past and running into people that, you've met over Zoom and everything. And so, I mean, what a great community. I'm really honored to sit on this panel and share a bit of my own and my family's story. My family has an extensive history of ALD and AMN. consisting of virtually every manifestation or phenotype of the disorder. In a way, it's somewhat fortuitous that I'm kind of wrapping up this patient panel because my family history includes childhood cerebral ALD, an example of a mutation of the ABCD1 gene mutation caught by newborn screening, and symptomatic females as well. My family has no fewer than 16 members affected by ALD or AMN, extending over at least 5 generations. This includes my maternal grandfather, my mother and her 2 sisters, my own sister, my nephew, my daughter, and 2 of my male first cousins. My grandfather's brother, my great uncle, also had AMN, and his daughter, my first cousin once removed, was also affected. Her son, my second cousin, passed away from childhood cerebral ALD as an older boy. Because both my grandfather and his brother were diagnosed with AMN, it is undoubtable that their mother, my great-grandmother, was also affected by ALD. However, since these 2 were adopted as youths, it is impossible to trace our family history with this disorder any further back than that. We don't know anything about my great-grandmother's involvement with the disorder. Living with such an extensive family history of ALD and AMN comes with both benefits and challenges. On the one hand, my family is quite knowledgeable about this disorder, its various manifestations, phenotypes, and symptoms. There also exists a fairly strong familial support system since we have all loved people who have lived with and passed away from this disorder. That knowledge and experience also comes with grief, loss, and uncertainties about the future. It really is not easy to watch so many other members of my family experience their own symptoms, manifestations of this disorder. I can certainly share with my cousin or my mother or my aunt about my own experience, but I can't tell them exactly what it will look like for them. And I still don't know, sorry. My wife and I still don't know exactly when or what, we're going to tell my 6-year-old daughter. About how this disorder may affect her or her future children if she chooses to have them. Having watched my own grandfather pass away at a relatively young age, he was 67, from symptoms related to AMN, is challenging both for me and for my male cousins who are living with AMN. While I recognize that it's pretty much impossible to predict my own life expectancy with this disorder, since it is not directly linked to my grandfather's experience, I live my life with the realization that I may not live to see 70. While that might sound morbid to some people, it allows me to prioritize areas of my own life that are important to me and to my immediate family, just living with that uncertainty. My earliest symptoms began manifesting themselves in my late teens and early 20s, starting with balance issues and spasticity. I experienced virtually all of the classic symptoms of AMN, ranging from mobility issues, leg spasms, bladder and bowel issues, fatigue, adrenal insufficiency, and neuropathic pain. In my case, the neuropathic pain in my feet and legs is quite severe and is one of the hardest symptoms to live with. It's constant, chronic, intractable pain. I've tried literally every type of potential medication treatment without success. I've also tried non-pharmacological options, some of them getting a little bit wonky, if you will, from acupuncture to red light therapy, topical ointments, and I even had a spinal cord stimulator implanted in my spine for a time. Unfortunately, none of that helped, and I now simply kind of live with the pain as best as possible. I don't have this in my notes to speak on specifically. I wasn't planning on addressing this, but in conversations with some people last night and this morning, some people, the question arose about why, with such an extensive family history, it took so long for me to be diagnosed. And I thought that was something that might be interesting to touch on just for a moment. Because I was not diagnosed until I was 29 years old, even with such an extensive family history. When I was an infant, they didn't have genetic testing. So my family was aware of the family history. My mother knew that she was an asymptomatic female at that point. So they did test my very long chain fatty acid levels as an infant, and they were kind of called borderline at the time. And so the doctors said to my parents, if he doesn't have really clearly highly elevated very long chain fatty acid levels, then he's good. Like, you guys are in the clear. You don't need to think about this ever again. And unfortunately, that was really not the case. I mean, I was living with undiagnosed Addison's disease for probably 15 years prior to my diagnosis. And as the symptoms kind of continued to develop, my dad and my mom, they kind of noticed, like, your legs spasm, like, just like your mom's do. Like, there's probably something going on here. And ultimately, it was my wife, who is a nurse. After we had been married for about a year and just her, witnessing so many of these things, she was like, you really need to go to a doctor, mention the family history, see if that's a possibility, and go from there. And so the time from actually seeing a doctor to receiving an official diagnosis was actually very, very short for me. It was just, it took years of time to actually get to that point because we just thought that I didn't have it. So kind of an interesting story there. Now I would like to transition to speaking about some of the things that have helped me personally. I want to share 3 things that I found most beneficial in living with and coping with AMN. The first for me was counseling. I began looking for a counselor about 2 years after my diagnosis, once I recognized that I just wasn't really coping that well. While I don't live with chronic depression, I absolutely have experienced situational depression as a direct result of the physiological symptoms that I've had to live with. I'm sure many of us can identify with that. I feel like nothing in life prepares you for what we have to experience, either as a male, a symptomatic female. There's really nothing like it. And fortunately, I found a counselor who had professional experience in working with people who live with chronic illness, and I've really found it to be invaluable. Truthfully, I mean, yeah, I honestly don't know. Sorry. Yeah, I honestly don't know if I would be here today without that. Being able to speak openly and honestly with a professional counselor about living with this disorder, the challenges in dealing with the symptoms, and especially fears about the future, not only for myself, but for my wife and my 2 children, has been deeply helpful to me. And I suspect that there's many of us here who could probably benefit from that. I recommend to other friends, living with other chronic illnesses as well, that is something that they may find beneficial. The second area that I wanted to speak about was community, and that can look different for each of us, from clubs, neighborhood or city programs, to faith-based communities, to recreational organizations. A big part of that for me has been finding adaptive sports. I first discovered adaptive sports about 4.5 years ago, and it has since become a major part of my life. Wheelchair basketball was the first adaptive sport that I tried, and I've also kind of dabbled in wheelchair tennis, and have recently gotten really into hand cycling as well. I've loved the sport of basketball my entire life, but after developing the symptoms associated with AMN, and especially after my diagnosis, I naturally kind of assumed that this part of my life was behind me, that the best years of engaging in sports were done. Finding adaptive sports organizations in my area really changed that for me. For the past 4.5 years, I've played for a wheelchair basketball team, and I've progressed to becoming one of the top scorers for my current team, which feels really good. I like to think that, you know, my best years of sport are still ahead of me. On a personal level, I mean, sorry, I'm a crier, as you can tell. So on a personal level, what makes it so meaningful to me is this. When there's so much going wrong with my body, physically speaking, it is easy to almost develop a sense of distrust for the body. By that, I mean, I cannot ordinarily trust it to do all the things that I want it to do. When playing the sport of wheelchair basketball, when everything about a play goes perfectly right, whether it's setting up a teammate for success or scoring myself, there's really nothing like the sort of high that can be achieved by my body actually doing something right. There's really nothing else like that for me. Of course, I mean, this doesn't have to be wheelchair basketball for everybody, but I highly recommend finding out whether there are adaptive sport or adaptive recreation opportunities available in your area. Finally, the third area is connecting with ALD and AMN specialists. Within 3 years of being diagnosed, my wife and I realized that we wanted to travel across the country to meet with a specialist. In years since, I've been deeply grateful to connect with specialists over video. And I still send some of these doctors copies of my MRIs each year to check for the development of cerebral disease. As I see it, this really is one of the best things about ALD Connect as an organization, creating opportunities for us as patients, as people living with this disorder, as family members, to connect with doctors and researchers, collaborating, engaging, helping, learning from one another. This ALD Connect community has really added a lot of meaning to my own life. Connected me with others living with AMN, and allowed me to both receive support and support others. I really am deeply grateful for the opportunity to speak at this conference and meet many of you in person who I hadn't met in person before. I'd like to sincerely thank Kathleen and the board of directors at ALD Connect for asking me to participate and to share. And I really welcome any questions that you all may have. Thank you very much.
Thank you, Aaron. Extremely touching. I just want to say a very special thank you to each and every one of you. I know it's not easy to come up here and spill your heart out and speak, just so deeply from the heart and share your personal stories. So really, truly, thank you so much. We really do appreciate it. We have a few minutes. Yes, another round of applause. We have a few minutes for questions, and then we are going to break for lunch. So do we have any questions for any of our panelists? Any online questions? If not, I will go ahead and ask some questions. Oh, yes, we do. Great.
Thank you so much. If you could tell something to your provider that they wish that they knew in the moment that you were diagnosed or had this news, what do you wish you could go back and tell them, or how can we be better providers?
When I was diagnosed, it was like, all right, at the time it was AMN. They said, this is what you have, come back, here's baclofen, come back and see us in 6 months. And that was it. I had no tools, no nothing. It was actually my dermatologist who had been cheering me on to get a diagnosis. He went home and did all the research, and he's the one who found Dr. Eichler for me. So then I randomly, it was the ALD meeting in my backyard a few months later, went, met some people, and then started seeing Dr. Eichler. So I wish that they would have given me some tools to get started on what do I do? How do I live with this? What are my next steps?
Maybe I'll ask a question from Morgan. So if I understood, it's a female baby screened. I know a little bit about the standard of care for male babies who are identified at newborn screening. What was the experience with a female baby? What could be better? What do you sense in terms of progress for information interpretation going forward?
Yeah, so that part was a little bit frustrating for me, to be honest. Having been part of the Facebook community and doing my own research, I kind of learned a lot more through that than through the providers. In the end, we were just told that my daughter was a carrier and there was nothing to be worried about. And I knew differently just from our own research and the community. Of course, it is different than if she were a male. But I am a symptomatic female as well. I didn't know that the things that I experienced on a daily basis had anything to do with a genetic disorder. But when everything came full circle, it kind of all makes sense. And the care for me kind of ended there as well, and there were no dots connected. So I actually had to do all of the legwork, and I have now scheduled an appointment with Dr. Eichler in March. So I think, which I think everyone knows, is the care for women and the attention to getting women care can be improved on, especially when there is a female diagnosed with a newborn screening instead of it just being, brushed under the rug. So that was my personal experience, and I think that can be improved on.
We have an online question, Kelly.
Yeah, so this is a question that we're asking our community this month for ALD awareness. So we'd like each of you to answer, what do you want your friends, family, community, doctors, what do you wish they knew about ALD? Or living with ALD?
Anything.
I can't top that one. I think the fact that it's sometimes not a visible disease, that many people with ALD are living with situations that you can't see from the outside, and they might be going through things that they don't talk about. And that you can't see, and just sometimes you might need to ask your friends or your family, like, hey, how are you doing?
Two big things that come to mind for me is listening and caring. I loved what Dr. Eichler had to say in his presentation this morning, where he really spoke on just like the sense of grief and loss and trauma and that is associated with having this disorder, loving somebody who has this disorder. I mean, the friends of mine who've actually sat down with me, asked questions, like learned about, what do you have going on? How does it affect you? How's it affecting you emotionally? Like, that is like the most invaluable thing. I think remembering, like you touched on, Dr. Eichler, about like the human elements of all of this, that this is something that it's beyond the science. I mean, of course, the science is critically important, but it's recognizing like how this actually hits each of us on a very deeply personal level.
I think I probably speak for a lot of women in this room that, we were told for years that it only affects men. So I'm glad that we're finally coming to the realization that women can be pretty severely affected as well. I don't actually have a doctor that knows anything about ALD other than what I educated them about. So that's something that we're really lacking, is the information available somehow to the medical community that can find out more information about what our symptoms look like, what can be done to help us with them. Even, like you said, mental health care would be an amazing thing, but they don't even know who to refer us to. So there's a huge gap in the women's territory for this disease. And I'm glad to see that we're starting to do some studies for us, and hopefully we'll start getting some results from that.
Can I add one other thing? Is that all right? I'm sorry, I know that I already spoke, but this actually touches on, I think it was Alex's question as well, about like what would you like providers or researchers to know too, and this all ties together. I think to not be afraid to reach out to specialists when appropriate. My local neurologist in the Seattle area, like he had never had an AMN patient. Another neurologist that I saw at the University of Washington shortly after being diagnosed, like he was calling, other colleagues of his like into the room because he was like, oh my gosh, like we've heard of ALD, AMN, but we've never seen somebody. Like I have somebody in my office. My local neurologist, I think he was in residency with Dr. Van Haren at Stanford, if I'm not mistaken. And so like they go way back. And so he has reached out to him from time to time just to say, asking him this question, asking him about, trials that he might be knowledgeable about. And I think, having the humility and the interest to just go the extra mile, to ask the extra question, like that is something that we desperately need for our local providers especially.
Being proactive and just really assertive with your providers too. I broke my foot a few years ago because of ALD. I was just walking down the hall and my leg gave out. Had 4 surgeries on this foot, and one of the PAs that I had to see was like, oh, it's just because of ALD. It's just because of ALD. And I know my body. Just know your body and just don't take people's brushing it under the carpet. And I was like, no, this is not my body. And so then I went to somebody else, and sure enough, it wasn't. I was, long story, growing extra bone under it, so I'd have another surgery. But some people will tell me to go to a physical therapist. I went there, and they almost babied me. I didn't want that. I wanted to be pushed. So I went to a physical therapist who, with safety, always safety first, but pushes me to my limits. And so it's just so important to be educated and know what you're doing and communicate with your doctors, and just keep pushing. Keep pushing.
Hi, I'm a patient of I'm a parent of a patient of ALD, and I know for a couple of years before he was diagnosed, which was this year, he was, basically inattentive, had ADHD. He was diagnosed with, autism, high functioning autism. So we worked with a neurologist, and, again, never got any, concept of what the underlying cause of the disease that he had until we happened to be on vacation in Utah, and just by chance he actually had a seizure and was airlifted to the hospital where Dr. John Bofkowski in his care, and quickly since that time has had the best care, top-notch care possible through that small community of connection. We just got lucky, and we've worked with Dr. Dr. Malik, and then also worked with Dr. Lund here. I apologize. So, as I said, since then, with that connection, we've had the best care. So the providers that are in this community, top notch, very wonderful, and my son's in the best care. There's not much we can do at this point, but unfortunately, it's too late in his diagnosis, but he is getting the best care possible.
All right, any other questions, comments? Everyone enjoy lunch, and thank you so much. One more round of applause for our incredible panelists.